Basic terms in anatomy and physiology. So in order to understand certain things in the body while in a clinical setup, it is important to know the basic terms in anatomy and physiology and the basic directional terminology. The body can be divided into specific areas visually called planes. But when you actually make an incision, it would be called a section. There are 4 major types of section. The first one is the sagittal section. Sagittal plane or section can be of 2 types, mid-sagittal and para-sagittal. A sagittal plane is a plane that divides the body lengthwise into the right and left portions. When the section or the line is exactly in the center, it will be called a mid-sagittal plane because it would divide the body into equal right and left sides. Now the parasagittal plane divides the body into unequal left and right side. Mid means the middle or right in the center. Para means alongside or beside. Okay, so para is going to divide the body into unequal right and left side along the length of the body. Now the next plane is the frontal or the coronal plane. The frontal plane is also known as the coronal plane. The coronal plane divides the body into anterior and posterior positions. Right over here, you see this is the frontal plane. So the frontal plane will divide the body into the front and back. So let's just say this is the side of the head. If we make a section like this and you get the front of the head and the back of the head, that will be called a coronal section. The third section is a transverse section. Transverse section is like when you take a log of wood, that was the lumberjack does, and you section it from the center, cut it into 2 halves along the length. That would be called a transverse section. So if you take this body and dissect it right along over here, in the manner you get a top and bottom portion, that would be called a transverse section. So a transverse section divides the body into superior, meaning the top, and inferior means the bottom, okay, portions. Superior means the top and inferior means the bottom. An oblique plane or a section is a section that cuts a region of the body at a particular angle. That's why it's called an oblique plane. Let's see if we can apply this to actual specimen. So this over here you see is the kidney. This is the whole kidney and this is the whole heart. Okay. And when you move on to a sectioned portion or section picture, you see the kidney and you see the heart over here. So this over here is the anterior portion of the heart. This edge is that of the anterior portion and this is the posterior. Posterior means the back and anterior means the front. What you're looking at from the top is the top view. Okay, so what section would this be when you actually perform a section? Okay, if you guess it as the transverse section, you guessed it right. So what you're looking at is the transverse section of the heart. And this is the kidney. And the whole kidney looks like a kidney bean shape, right? So what you're looking at right now is the frontal or coronal section of the kidney. A frontal section of the kidney would give the front and back portions of the kidney, whereas the transverse section would give the top and bottom portion. Let's just say you want to make a transverse section of the kidney. You'll cut the kidney this way along, okay? Anatomical position is very important to understand. The term itself describes the body standing erect, so you need to stand straight, and you need to have the feet facing forward. Make sure the feet are flat on the floor together, eyes facing forward. Okay, so eyes looking right at you, the palm facing forward as well. You cannot have the palms facing backwards. This is very, very important. So the palms facing forward is called supine palms. Supine means facing forward. Remember, supine has the word up in it. So supine means the palms face up. Okay? So palms face forward, eyes directed towards the arms at the side, and the feet together flat on the floor facing forward, and the body erect. This is the anatomical position. And when we use the terms right and left, they are used to refer the specific sides of the body in an anatomical position. And when we use the term right and left, you're always talking about the right and left of the subject. Okay, so when you're looking at the subject, this becomes the right and this becomes the left. Make sure you know this really well. You cannot get confused between the left and right, especially when you're looking at the figure of a bone or a figure of the heart or a kidney. You need to know which is the left and right side. Very important. Because if you don't have the left and right side figured out, let's just say you end up going to medical school and you got confused between the right and left, you're going to end up pulling out the wrong kidney of the person. So this is very important. Right and left of the subject. Okay? Directional terms will be used to describe different positions relative to the body parts. There are important directional terms in anatomy that you will come across all the time. The first one is superior and inferior, which is fairly simple. Superior means above. Like superior at a workplace means somebody's boss, right? A superior is above, inferior means below. Superior also means towards the head. Inferior means away from the head as well, okay, or towards the tailbone. For example, how would you use superior? The thoracic cavity or the chest is superior to the abdominal cavity or the stomach because the chest lies above your stomach. Inferior. The neck is inferior to the head because the neck sits below the head. So the neck is inferior to the head. Cephalic and caudal are the terms that can interchange with superior and inferior in humans. Cephalic means towards the head. Caudal means towards the tailbone. So cephalic means towards the head and caudal means towards the tailbone. Anterior and posterior. Anterior means the front. Posterior means towards the back. Now, let's pick an example for you to understand. Let's look at the position of eyes with respect to the brain. The eyes are on your face, in front of your face, right? So the eyes are anterior to the brain. So the eyes are anterior to the brain. What about the brain? If you want to interchange it, the brain is posterior to the eyes. All right, so ventral and dorsal can be interchanged with anterior and posterior in humans. Ventral means towards the front or towards the belly side. So anterior and ventral means about the same, and dorsal means towards the back. Okay. Now proximal and distal. Proximal is used in reference to the arms and leg, to the point of attachment. Okay, let's just say this is the torso, that's the head, and these are arms, okay, and legs. So proximal and distal are used in reference to the limbs of the body with the point of attachment. So in this case, the point of attachment is the torso. Okay, so proximal means closer to the point of attachment. Proximity means the closeness of something. So proximal means closer to the point of attachment. Distal means distant, means farther away from the point of origin or attachment. Let's pick an example to understand. The elbow of a person, so that's the elbow, and wrist are, okay, let me scratch that. Let's just say, let's pick the example of elbow and the wrist with respect to the shoulders. Okay, so the elbow of a person is proximal to the shoulder, whereas the wrist is distal to the shoulder. Okay, so we are using these terms to compare the proximity of the region of the limb to the shoulder. Okay, now if you talk of the knees and the toes are farther away from the point of attachment, whereas the knees are closer to the point of attachment. So the knees are proximal to the hips, whereas the toes are distal to the hips. And then we have medial and lateral. Medial refers to an imaginary center line that divides the body into the left and right halves. Okay, so let's just say the nose and the eyes. The nose is medial to the eyes because the nose are in the center, is the center of the two eyes. Lateral refers towards the side of the body, means away from the midline. Okay, if the nose is medial to the eyes are lateral to the nose, right? Or you can also pick another example. The ears are lateral to the eyes and nose because the ears are toward the side of the body. Intermediate means in between the two structures. So if something is intermediate, okay, so let's again, the eyes are intermediate to the ears and the nose because they are in between the two structures. Afferent and efferent. Afferent means moving into an organ of importance, and efferent means moving out of the organ of importance. You will come across these words in the nervous system, but for now you don't have to worry about it too much. Parietal and visceral. Parietal means the outer wall or structure. Visceral means the inner wall. Okay, The heart is protected by two layers. So the innermost layer that is in contact with the heart itself will be called the visceral layer. Around the visceral layer, you have another protective layer that will be called the parietal layer. Superficial and deep. Superficial is used when a body part is more external or towards the surface. Deep is used when the body part is more internal compared to the other part. Okay, so the superficial layer of the skin is called the epidermis. And the deeper layer of the skin are the, let's just say, the dermis. And they have the hypodermis, right? You have heard hypodermal needles. So epidermis is the first layer. So epidermis is the superficial layer of the skin. Whereas the dermis is the deep layer of the skin. And hypodermal needles you've heard because they're injected into the hypodermal layer, fat layer. So those are hypodermal needles. So the hypodermis is deep layer of the skin. Okay, let's quickly revise the terms. Superior means above. Anything towards the head can be called superior. Or cephalic. Superior also means towards the head. So cephalic. Let me write that down. Superior or cephalic can be used interchangeably. Inferior and caudal can be used interchangeably. Okay. Proximal means closer to the point of attachment. So the elbow is proximal to the shoulder, whereas the fingers or digits are distal to the shoulders. Midline is a line, imaginary line at the center. So the let's just say the spine is medial to the lungs because the spine is in between the lungs. And since it's exactly in the center, you call it that you can say it's along the midline. Okay, so it's medial to the center. Lateral means along the sides. You have the appendix is located on the right side of the body. Okay, so the appendix is located lateral to the spine. So that's the appendix and that's the spine. Where the spine is located medial to the appendix. Alright, so if you look at this picture again, ventral or anterior mean the same thing. Anterior or ventral mean the front. Posterior or dorsal mean the back. Okay. There are several different body cavities, but overall they can be divided into the ventral cavity towards the front of the body or the dorsal cavity if they're towards the back of the body. So the ventral cavity is made up of the thoracic cavity where you have the heart and lungs, and then you have the abdominal cavity that contains the digestive system and all the accessory organs, and the pelvic cavity. The abdominal and pelvic cavity together can be called the abdominal pelvic cavity because they are connected to each other. There's no separation between the abdominal and the pelvic region overall. And the structures that you find in the abdominal pelvic cavity include the digestive system, appendix, the kidney, the colon, And then you have the pelvic cavity, which contains the urinary system, which includes the bladder, and the reproductive organs, also the rectum. The dorsal cavity is the second type of cavity. The dorsal cavity is made up of the cranial cavity and the vertebral cavity. The cranial cavity contains the brain. The cranial cavity is directly connected to the vertebral cavity in the back. And that's why the cranial cavity, although it protrudes towards the front, is considered to be a part of the dorsal cavity. So the structures that are present in the dorsal cavity include the brain in the cranial cavity and the spinal cord and the vertebrae in the vertebral cavity right over here. Okay. The vertebrae is actually on the outside, it's technically not present inside the vertebral cavity. The skull and spinal cord protect the vertebral cavity. Yeah, that's correct. The abdominal cavity is a really big region and you find so many organs over here. So for ease of understanding and to make things simpler, the abdominal region had been divided into 4 quadrants. Okay, so quadrants means 4 parts, right? So quadrants and 9 regions. So the quadrant on the right is called the right upper quadrant. Then you have the quadrant on the right lower region. It's called the right lower quadrant. Similarly, you have the left upper and the left lower quadrant. Now, why is this important? When you go to the doctors, they palpate your abdomen to wonder what they're feeling for and to understand, to make things easy and to, of course, write down which region in the abdomen you're having issues. Quadrants are easier to identify than just saying the abdominal cavity. Okay, it's like looking in for a needle in a haystack if you use the word abdominal cavity for just any organ in that region. So some structures that are found in this region. Well, let's start with the right upper quadrant. What do you have in the right upper quadrant? You have the kidney, you have some part of the stomach, you have some colon, you have small intestine, etc. And you also have the gallbladder towards the right. Towards the left, you have the stomach, you have the 10th ribs over here. You have the spleen in the back, a part of the pancreas, a large portion of the stomach is on the right. And to the left, what do you have? You have the cecum, the appendix, parts of the small intestine, the right ureter is over here. And towards the left, you have, again, you have the left ureter and a large part of the intestine over here. Now, this is still very busy. You have a lot of structures in all these quadrants. So these quadrants can further be divided into 9 regions. Let's start with the region in the center. That is called the umbilical region. Umbilical means the belly button or the belly. So the umbilical region is the region around the belly button. Okay. Gastric means stomach. Okay. So epi means above. Epigastric region becomes the region above the stomach. Hypo means below. So hypogastric region becomes the region under the stomach. Okay. And what do you have over here? Oops, this is stuck. Then you have the what do you say? Okay, that was stuck for a minute. Sorry about that. Okay. Then you have the regions laterally located. The region on the top over here is called the hypochondriac region. Hypo means below. Chondriac refers to the soft tissue and organs under below the ribs and the cartilages. Okay, so this region is called the hypochondriac region. Lumbar region is just about down well below the spine. Lumbar means the back. Okay, so lumbar region is the back. So this region is closer to the back. So this is called the lumbar region, or the hips. This region all the way to the bottom is called the inguinal region. Right over here we have the groin. Okay, this area has a ligament known as the inguinal ligament. So this region is called the inguinal region because it's closer to that ligament. Now there are a few lines. This over here is called the subcostal line. Costal means the ribs and the cartilages. So subcostal means below the ribs and cartilages. So this is called the subcostal line. So you see the subcostal line over here. And these two lines are called the mid-clavicular line. Now the word clavicle means the collarbone. So these are your clavicles. The mid-clavicular line is an imaginary line that divides the clavicles into two equal halves. So this line over here is called the mid-clavicular line. And is there any other line that I left out? No, that I know of. Okay, so these are some terminologies that you need to know, and you can expect to see this picture if you have an exam. Now the last portion is some regional terms that we use in anatomy and physiology, and in general the clinical setting. So you see, I like this picture. This is from OpenStax, I think, or it's from Wikipedia. I should have put the reference, I forgot. But this picture is nice because it describes the clinical term or anatomical term along with the common terminology. You will need to look at this picture and know the meaning of the anatomical term and the common term. Because when you're explaining it to the patient, you can't say coxal region. They'll be like, what? So you need to say around the hip, right? But when you're studying or writing a report, you need to make sure you use the correct anatomical terminology. All right. So you're looking at the anterior view of the subject. Anterior means the front. Also the ventral, right? Ventral, anterior, front, they all mean the same thing. Keep that in your back of your mind. So this is the front of the subject. And when you're looking at the anatomical position of a person, this becomes the right and this becomes the left. Never ever forget that. But now you're looking at the posterior view of the subject. So this becomes the right and this becomes the left. Okay, because she's facing the same direction as you are. So your right becomes her right in this picture only. But in this picture, very, very important that you know that this is the right and this is her left. All right, so back to regional terminology. There's so many different regional terms. I'm just going to pick a few, but you need to know all of these that you're seeing in the picture. Frontal means the forehead. Temporal means the temple, right? Because you have the temple. When you chew, you can feel your temple. Aortic means the ear. Buccal means the cheek. Sternum means the chest bone. So this, you can feel your breastbone over here. That's the sternum. Thoracic means the chest. So any structure in the region is in this thoracic cavity. So thoracic means the chest. Mammary means breast. You know, they talk about mammary glands. Those are glands in the breast. Umbilical means the belly button. Inguinal means the groin because of the inguinal ligament on both sides. Pollex means the thumb. Palmar means the palm. Digits or phalanges means fingers. Femur or femoral means the thigh. Femur is the bone in the thighs, the strongest bone in the body and the longest bone in the body. That's the femoral bone. The pubic region is the pubis. And then these terminologies will slightly differ when you're looking at the male that we'll look at in just a second. Then you have the ankle, which are known as the tarsals. The digits are known as toes in layman's terms. So digits of phalanges are the same when you're talking of foot or the palm. The top of the foot is called dorsum. And when you're looking at the posterior view, the back of the foot or the sole is called the plantar region. Crural means the calf. Calcaneal means the heel. Okay. Popliteal specifically means the back of the knee. So when you feel the back of the knee, you're feeling the popliteal region, right where the fold of the knee is, right in the back. Perineal region, perineal really in between the anus and the external genitalia. So this region over here is the perineal region, so the bottommost region of the body. Coccygeal region means the region at the tailbone. It has been named after the coccyx, which is the tailbone right over here. Glutes means the buttocks. When you're working out your glutes, you're working out your buttocks. So the gluteal region means the buttock. Sacral region means the region in between the hips. And then you have the olecranon or the olecranal region, that is the back of the elbow. The vertebral region means the spine. The scapular region means the shoulder blades. So if you move your shoulders and you can feel your shoulder blade moving with the other hand if you place it in the back, that's the scapular region. Acromial region is the shoulder. Occipital region is the base of the skull because you have the occipital bone over here. But the back of the neck itself is called the nuchal region. Nuchal region, N-U-C-H-A-L, nuchal region. Cervical in general means any area on the neck. Cephalic in general means any area on the head. Now, a lot of these terminologies are same for male and female, except for when we talk about the smaller regions in the genitalia. But for now, you don't have to worry about it. We'll talk about the main differences in this region, in the pubis region, when we get to the reproductive system.